सर मत हिलाइए. Nobody knows. अरे एक्सेस K2 की एक्सेस बताओ.
पृथ्वी की एक्सेस पृथ्वी की अरे मतलब वॉल जोड़ा तो तुम वॉल जोड़ा कर.
Now this doesn't seem like 180. It is not. It is not diagonally opposite. See, this scratch is here, and corresponding scratch should be diagonally opposite. It is not there. So ना ठीक है. That is part of the game. कॉर्निया आउट करो. यहाँ पे कॉर्निया को ट्राई हो रहा है सूटी में. इसको डाल दो. नहीं ये है स्पेसिफिकली यहाँ पे, या तो कुछ एयर की प्रॉब्लम है, ड्राइनेस ज़्यादा है, व्हाटएवर. Don't use non-technical words when patient is on the table. The patient is actually listening to your conversation and he is making judgment out of that. When we were up to 135 पे लग गया. So when I was a student, PG student, so Dr. Pratap was the HOD and operating surgeon. रोशनी में देखिए. So he was a very restless surgeon. Say I'm a lazy surgeon, he was a very fast surgeon. He wanted everything to be done quickly. So if there was some delay, he would throw away the instrument. And being a HOD, who had that liberty. So one fine day he was operating and this suture broke. It was the era of ECC. So he said that, he exclaimed, like, "Arey, to toot gaya." Then he was handed over another suture and he finished the surgery. Now that patient kept on roaming for the rest of his life, showing different doctors, because something broken has been implanted in my eye. And I know this fact because he came to me also. So ऐसा हुआ था. And so you see, they are paying attention to whatever we are saying. And that is why रोशनी में देखिए, रोशनी में. Shivani, you know what is ingenuity? Ingenuity क्या है? That is a viewing system, 3D viewing system. So the microscope has camera inbuilt, and there are two cameras, each capturing the image for each eye. And there's a monitor which will project both the images simultaneously, and you will wear glasses. So glasses will, each eye will receive only one image. So the TV is projecting both the images, but your each eye views only one image. So you get that stereopsis on the monitor. And because that image is captured in 4K and that monitor is large enough, so people say that it gives you a very good view. And then you operate by looking at the screen. Like for example, if I'm looking here and operating here. And because it gives you a 3D view with depth perception, so it can be done. So have you heard of this?
There's also like we can operate it from somewhere else and the patient is somewhere else.
That is a further extension. But do you think you would advocate that.
Yes.
There are so many technical hiccups.
And there's
What?
also 4D machine for the paper.
What is it? Like,
It's like microscopy inbuilt.
रोशनी में देखिए. So what does it do?
जो time और energy in the nucleus वो minimizes half.
How?
There's an inbuilt laser or something we press on the cornea and just for a
अरे इसका स्लीप फट गया.
Mansi,
No, you are not using any correct explanation. You are just using technical jargons.
I don't know the actual term for it.
That is what is important. Somebody comes and tells you that this OT is superior, that ground floor OT is inferior, and you would start believing that. टेक्निकल नो हाउ के बिना आप नहीं करते. कोई बात नहीं, सही करते. स्लीव छोटा होगा, स्लीव छोटी होगी है. अच्छा, इसमें कोई चूड़ी नहीं बनी है, इसको जितना चाहे उतना पुश कर दो, बस इतने पे रुक जाएगी. वैसे तब भी ज्यादा ही निकली है. चलो करते हैं. जोर मत लगाइए, उल्टा थक जाएंगे थोड़ी देर में. कॉर्निया वेट करो, कॉर्निया वेट करो. He is a very uncooperative patient. Although I have to push the eyeball down, and then only he is maintaining that gaze. Also moving his head. So what do you think? Should these patients be subjected to local anesthesia, or should they be operated in a topical?
Once the probe inside, we can manipulate the eye accordingly.
But what about that losing patience, patient repeatedly requesting?
We can give that.
I say requesting, Apurva says something else. But that conversation, is it really helping us in any way? I personally believe that he is giving his full effort. A few patients just don't understand, or maybe they don't have that much of self-control. Just like a child, you may ask him to stabilize eye, he'll just not, he's doing his best, but the reflexes are too strong. कोई चिंता की बात?
नहीं सर, देख रही थी.
इसलिए तो मैं पूछ रहा हूँ. देख ले भैया. What is the advantage with these preloaded IOLs? नहीं, बंद नहीं करिए, सीधा रखिए, दोनों आँख खोलिए. These are so advantageous for people who are presbyopic. So if you have to load the IOL yourself, सामने देखिए. अभी रुक जाइए. वैसे भी टांगे हुए हैं वहाँ अपनी. देखो इन्होंने क्या किया, देखा? नहीं देखा? रोशनी में देखिए. नहीं, इसकी कहानी भी बन गई है, आपको नहीं मालूम, अभी बताते हैं. क्या हुआ कि एक पेशेंट, आपको याद होगा, पिछली ओटी में हमने उसका विट्रेक्टमी किया था विद एसी आईओएल,
यस सर,
याद है?
यस सर।
उसमें जब सर्जरी पूरी हो गई तो एंटीरियर चेम्बर वॉश करने के लिए आपने मुझे रिंगर दिया था,
यस सर।
आईए नहीं दिया था।
हाँ, क्योंकि सर उसका वो ऑलरेडी कनेक्टेड था ना ये का उसमें।
हाँ, वो जो भी है।
हाँ।
अब ये बताएंगे डॉक्टर शिवानी।
तो उसका प्रेशर बढ़ा हुआ था। हाँ, थोड़ा एंटीरियर चैम्बर में रिएक्शन।
एक्चुअली विस्को जो छूट जाता है ना,
यस सर।
ये थोड़ा इन्फ्लेमेशन करता है।
ओके। एक्चुअली उसको ऑलरेडी उसमें ये में
वो नहीं है
connected था
मुद्दा,
ना vitrectomy
अरे
में।
वो वजह कोई भी हो,
हाँ, हाँ।
क्योंकि अल्टीमेटली it was my responsibility that if I felt that it was inadequate
Yes sir.
to use the syringe to flush and not do IA, that is my responsibility. So don't take blame on yourself. But I am just letting you know that why did I pointed it out
Yes.
when you offered me a syringe for flushing rather than IA. ये कुछ हुआ? So you think that we wash the anterior chamber for adequate time or less or more? Even then you see there is still some visco there. Now, this is so annoying. You spend whole 1 minute flushing it and then when you go inside you find there's still some left. Single region. Now, the chamber is also leaking. So when you have a leaking chamber like that, first thing you do is you hydrate the incision. You can hydrate one side. Patient is very uncomfortable. इस तरह से आँख हिलाएंगे ना तो लेंस बाहर आ जाएगा। आप बात की गंभीरता नहीं समझ रहे हैं। मैं टोक रहा हूँ आपको बार बार, आप तब भी घुमाए जा रहे हैं। आप ही की आँख है, भला बुरा आप ही का होगा। कोई तकलीफ थोड़ी ना होती है, बस आप अपनी मर्जी लगा रहे हैं उसमें, हमारी नहीं सुन रहे हैं।